Okay. Ividuന്ന ഈ മോഡറേറ്റർ ആയിരിക്കും മാഡം ഇവിടുന്ന് സംസാരിക്കുന്നത്. മറ്റേ സ്പീക്കേഴ്സ് എല്ലാം പലയിടത്തും ജോയിൻ ചെയ്യും. അവർക്കെല്ലാം ഇമെയിൽ പോയിട്ടുണ്ട്. അവർ കയറിക്കോളും. ഓക്കെ ഓക്കെ. ഇവിടുന്ന് ഇപ്പൊ എന്താ സ്ക്രീൻ ഷെയർ ചെയ്ത് ഇവരുടെ PPT റൺ ചെയ്യണം. തന്നെ അപ്ലൈ ചെയ്യുന്നതാണ്. PPT ചെയ്തേക്കാം. വീഡിയോ ഇതാണ്. ഇത് തന്നെ നീക്കിയോളൂ. നീക്കിയോളൂ. ചെയ്തില്ല. കുഴപ്പമില്ല, ഇത് മാറിക്കോളൂ. ഞാൻ അപ്പുറത്ത് നിന്ന് മറ്റേത് ഇപ്പൊ സ്റ്റാർട്ട് ചെയ്ത എന്റെ 2 സെഷനും. അപ്പൊ ഇപ്പൊ ആ സ്റ്റാർട്ട് വെബിനാർ കൊടുക്കണം. കൊടുക്കുന്നില്ല. യൂട്യൂബിൽ ഇപ്പൊ നമ്മൾ ഇത് ഷെയർ ചെയ്യുമ്പോൾ മുതൽ ഇത് കാണാൻ തുടങ്ങും. ഇപ്പൊ കാണുന്നുണ്ടായിരിക്കും. ശരി ശരി. വീഡിയോ സ്റ്റോപ്പ് ചെയ്യണം. അപ്പൊ എന്നിട്ട് ഇവിടെ ഇത് മാറ്റിക്കോളാൻ കൂടാ. മച്ചാനാ
ഹലോ, രഞ്ജിനി, ഞങ്ങളുടെ അറേഞ്ച്മെന്റ്സ് ചെയ്യുന്നതേ ഉള്ളൂ. പറഞ്ഞോ എല്ലാം ചോദിക്കാനാണോ? ഞാനെല്ലാം ചോദിക്കട്ടെ. പക്ഷെ എല്ലാരും കാണും. കാരണം ഇത് ഓൾറെഡി യൂട്യൂബിൽ ഉള്ളതുകൊണ്ട്.
ഹലോ.
Morning, Soni.
Kanchana madam.
Yeah, good
So,
morning.
good morning, ma'am. Soni madam will be joining just now. She is gone down to take something. She'll be coming now. She was here. എന്ത്?
Yeah, good morning, Soni.
Good morning, Jenny ma'am. Kanchana.
Jenny ma'am, Soni madam will be coming now. She has gone to take something.
Hi, ma'am. Host mutes us immediately, so we can't continue to talk.
We'll mute ourselves.
Yeah, we'll mute. And probably when they call in, we can come in.
Yeah.
So the webinar is not live, YouTube channel is live, so be cautious when you're talking. YouTubers are listening.
Okay, sir. Okay.
Okay.
Good morning, ladies and gentlemen. Today, 10 September 2020, on behalf of our management, principal, and Department of Community Health Nursing of Pushpagiri College of Nursing, has organized a national webinar on the topic MLHP, Mid-Level Healthcare Provider. MLHPs can be defined as frontline health workers who have been trained to diagnose and treat common health problems, to manage emergencies, and to refer them appropriately. The integration of concept of mid-level healthcare provider in basic and post-basic B.Sc nursing curriculum by the Indian Nursing Council has stimulated our thought process to update ourselves in the various aspects of MLHP to achieve the aim of universal health coverage. So before we start the webinar, let's seek God's blessings with a silent prayer. The duty bestowed upon me is to welcome the gathering. Let me welcome Reverend Father Jose Kallumalikal, CEO, Sri Jacob Punnu, C and Controller, Reverend Father A.B. Padakandala, Director of PCO, Pushpagiri College of Nursing, Sister Teres SIC, Principal College of Nursing, and it is a pleasure to welcome our versatile panelists, Dr. Kanchana, Dr. Janie Kemp, and Dr. Soni M. Verghese. And I also welcome all my dear participants. If you were not there, this webinar wouldn't have taken place. And I also welcome one and all. Now let's have the inaugural address. It's my pleasure to welcome Dr. Santosh, Principal of Pharmacy College of Pushpagiri College of Pharmacy, for the inaugural address. Santosh sir, please.
Respected Sister Therese, Principal, Pushpagiri College of Nursing, and respected speakers, and my dear participants of this online webinar from all around India and abroad. A very good morning to all. I'm extremely happy that the College of Nursing is arranging a series of seminars, webinars during these days. And first of all, at the outset, I congratulate the principal and all the organizing committee, particularly Department of Community Health Nursing, for arranging such a very relevant seminar on a topic of MLHP. See, as far as the community services are concerned, this is very important that mid-level healthcare providers are serving the community a lot. In this area, definitely nurses, they are particularly serving this area, and they can be one of the best healthcare provider as far as the community services are concerned. So in this aspect, this topic is of prime importance, and definitely those who are participating, they will be enriched by the classes of today. As you all know, the university, all the university, they have taken initiative to start this program. And those who are attending this program, definitely they will be serving as community health officers later on. Or this is a good opportunity for this nursing profession as well as for the community. With the permission of the organizers and those who are online, and with the prayer to God for these blessings, I'm extremely happy and proud that this webinar is declared inaugurated. Thank you very much.
Thank you, sir, for the inaugural address. Now, let me invite Mrs. Ranjini Devi, Vice Principal of Pushparik College of Nursing, to felicitate the gathering.
Good morning to all. Respected Sandosh sir, Principal Pharmacy College of Nursing, Sister Therese, Principal Pushpagiri College of Nursing, Mrs. Matthew Soni, HOD Department of Community Health Nursing, resource person, organizing committee members, and dear participants. Is it audible?
Yes, yes.
Okay. There are special moments and occasions in the life of every community that brings people together. Today is one such day. Pushpagiri College of Nursing organizing a regular series of webinars on educational dimensions on various topics, which is relevant to the healthcare professionals, educators, and general community. This kind of webinars remind us of what the institution stands for. We, Pushpagiri College of Nursing, stands for the best in academics and for unending pursuit of excellence. We uphold the value of love transformed into service and deeds of kindness. Today, Pushpagiri College of Nursing, Department of Community Health, organizing a national webinar on MLHP. We know that today people are more secure about chances of surviving. Prevention, early identification, and management of disease are very important. Having an excellent secondary and tertiary healthcare facility is mandatory, but it will never suffice until we focus on primary healthcare. However, focus on primary healthcare require human resources, which is presently a luxury in India. The solution may come in the form of middle-level service providers who are playing a crucial role in healthcare sectors of many countries around the world. Mid-level health workers should include as a part of general planning and management of healthcare system. They are the promising resource to augment the capacity of health and wellness centers to offer expanded range of services closer to the community. This is only the outskirt of MLHP. We are really proud to be with a panel of eminent resource persons to deal with the mainstream of MLHP. Dr. Kanjana, Principal, MLHP College of Nursing, Chennai. Dr. Jenny Kempf, Principal, GNKM Institute of Nursing, Coimbatore. Dr. Soni M. Varghese, HOD Community Health Nursing, MOSC College of Nursing, Palanjeri, Kerala. A panel of very good academicians and administrators. Madam Kanjana had taught our principal, Sister Therese, during her college days. Today, Sister is preoccupied with unavoidable official work, due to which she was not able to address this gathering. But she conveyed lots of love to Madam Kanjana, and she entrusted me to say regards and love. On behalf of our principal, I wish each one of you very best. We are really lucky to have you all as our panelist. This webinar will not be possible without an organizing team and their voluntary efforts. Let me congratulate Mrs. Soni Matthew, HOD Community Health Nursing, Sister Mayuka, Assistant Professor Community Health Nursing, Sister Serena, and a team of IT professionals for their selfless efforts to make this event a grand success. Life is made beautiful by shared moments like this. I can see the eager faces of all around, looking ahead in anticipation. On behalf of Pushpagiri College of Nursing, let me wish all you present here, especially our participants who have contributed to the webinar in a special way. I wish each one of you very best. May God blessings always be with us. Thank you. Wish you all success.
Thank you, Ranjini ma'am. So now a few instructions to the participants. Actually, we have a registration of more than 2,500. So sorry, we couldn't make all of you enter into the Zoom. I have provided the YouTube link. So maximum share for all the registration people. Okay, so a few instructions to the participants. If you have questions, kindly share in the chat box. The participants are requested to keep your microphone mute to ensure the quality of the session. Feedback link will be provided at the end of the session in the chat box. E-certificate will be awarded after the prompt submission of feedback form. So let's start the session. To begin the session, it is with great pleasure I invite Dr. Kanchana S., Principal and Director of Research Center, MLHP College of Nursing, Chennai, to talk on the topic, Nurses Bridge the Health System Gap, Ayushman Bharat. She has completed her postdoctoral fellowship from Queen Margaret University, Edinburgh, PhD from MP Boj Open University. She has done her UG from Ramakrishna and PG from MLHP College of Nursing. She has received many awards, but to name a few, the Best Teacher Award from Dr. MGR Medical University, the Best Nurse Educator from Tamil Nadu Nursing Council. She has published and presented various scientific papers in national and international level. Her hobbies, driving, driving, and I think if it was not for COVID, she would have driven and come to Pushpagiri College of Nursing for this webinar. And she's also a good researcher. I have heard many webinars where she was the resource person. She has a lot of interest in research activities. So ma'am, the virtual platform is yours. Kanchana ma'am?
I'm here. Can you hear me?
Yes, yes, ma'am.
Yes,
Yeah.
ma'am.
Okay. First of all, a very happy morning and a happy learning day to all the audience who are out there. And I really thank the organizers for this virtual platform, giving an opportunity for us to learn more about the virtual reality of presentations and how to interact and all those things we are learning only. I think COVID has taught us another lesson too in our professional career. It is always a pleasure when it comes to community. And when you're going to address something which is close to your heart, I think being more passionate about working in community from the days of 1995 when I did my first research, it was in the area of role play for effectiveness of role play on first aid for bites and stings in a community health setup. I think that was a research project which I took when I was 95, 96, my final year program. So that day I developed the passion towards community, and slowly I have been mentored to take up community. And now I'm very happy because if not for prevention and promotion, any number of hospitals which are going to come, let it be trust hospitals or let it be any corporate hospitals, it is not going to enough to cater. That is the current situation what we are doing. If you're not able to prevent, if prevention was not taught in COVID of hand washing, masking, and social distancing are preventive concepts. If these preventive concepts are not followed, none of the hospital can be able to act to the situation of what number of patients who are coming in. So I think that is the actual scenario, and COVID has taught us the real scenario for prevention of health diseases. And I'm sure all of the departments accept that it is very important. Any specialty, Altogether, the first level is illness prevention, and illness prevention and health promotion takes the major role. I think India also realized this. And I would like to screen share. Can I go ahead, Sony?
Yeah. Yes, ma'am.
Is it visible?
It's just coming.
Yeah.
Yeah, it's visible.
Yeah. So I think the national health government realized the need that there needs to be a transitional or, a paradigm shift in how health is being visualized, by the healthcare givers and the consumers. So both ends, this gap we had in our national health system where we were focusing. See, at the level of illness prevention and promotion, we can't think about specialization. We were focusing more on RCH. We were focusing more on very specific communicable diseases like TB, filariasis. There are many things which we have done. But beyond that, the government started feeling that there are hidden silent killers which are growing in disease burden in the community. And those are the non-communicable diseases which are really taking a toll on the population. People die very young because of this non-communicable diseases at the productive years, leaving families to suffer. And I think that is when the National Health Mission, which is actually a system, has thought about that they have accountability to address to those people who are dying of hidden or silent killers like the diabetes, hypertension, cancers, and mental health, very importantly, mental health. So all these system gaps were identified, and only at that point of time, the national government released the system for Ayushman Bharat. Actually, when it came in immediately, people were not able to understand how it is feasible and how it is possible. How could they reach these kind of services to the marginalized people? Marginalized people, I'm telling people who are living even in the tribes, who are living at the footfalls of the mountains and hills. So how are they going to be reached? So that is when they found a very important guideline, which is called as an operational guidelines for how this Ayushman Bharat is going to be envisaged, was written down. And as we said, who is responsible for this Ayushman Bharat to succeed? They have identified Ayushman Bharat as the pathway to achieve universal health coverage. Now, this year is a year of nurse and midwife. All of us know that. World Health Organization has entrusted this year. The whole year has been celebrated as a year of nurses and midwives, and the toll is on the nurses this year for the COVID pandemic which they are working in. So this year, why did WHO announce? Not only because it is the 200th year of Florence Nightingale, but also they realized that if not for nurses, it is very difficult to achieve universal health coverage. And that is the reason why they have dedicated this whole year to bring into limelight, to give recognition to nurses, to understand that the health wellness is very, very important, which can be handled at the earlier stage. So you can prevent people going in for complications and going in for tertiary care if we handle them in the primary care. So Ayushman Bharat is seen as a pathway or road towards achieving universal health coverage, that is the sustained developmental goals achievement. Now, if you see Ayushman Bharat, it is operationalizing health and wellness centers to deliver a comprehensive primary healthcare services. Now, this comprehensive, that is what we call as holistic. We have been focusing on reproductive child health independently before. We were talking about separately on tuberculosis. We were talking about separately on cancer. But now they realize that pulling in manpower for individual specific diseases is also difficult. And once we give them a roles and responsibility, we can't keep adding roles and responsibility to one person, because that is going to be felt as a burden, and the quality of care will definitely go down. So what they thought, what the National Health Mission or the government thought is, it is important that there is a comprehensive or holistic approach to healthcare services. And that's how they coined this Health and Wellness Center, which is very key important, plays a very key important role towards achieving Ayushman Bharat. So as I said, for very selective approach, they went to a comprehensive healthcare approach. So that selective is the RCH, the reproductive child health. And then now we are going for comprehensive. We are not only talking about RCH, we are talking about prevention of illnesses. We are talking about promotion of health. We are talking about how the continuum of care will be dealt at the primary level and how the continuum of care will be dealt at the secondary and tertiary level. So that is where from the selective approach, we are going in for a comprehensive healthcare approach, where the comprehensive will talk about preventive care, promotive care, curative care. Earlier, we stopped with this, with curative care at the tertiary hospital. Now, the additional is the rehabilitative and palliative care services. Now, palliative care has become very important concept in our day-to-day life. We are seeing so many people around us who require this palliative care. And that's how rehabilitative and palliative care has been added on to our earlier concepts. So preventive, promotive, curative, rehab services and palliative services form the array of care which comes under the health and wellness centers. So what is this Ayushman Bharat covers? They cover about health insurance has been given for up to 5 lakh rupees to 10 crore poor families. See the number, see the huge, and the whole family. Say a minimum, we have 4 to 5 people in a family. A 5 lakh cover is a very good cover given by as free of cost to our poor and marginalized people. So to 10 crore poor families, why they envisage this? Because they understood that the maximum out of 72% of the out-of-pocket expenses where the public are doing is for primary care. Now, this primary care is what you can do it at health and wellness centers. And when you need higher advanced care, you have to spend a lot of money onto that. So they felt that for primary care, health and wellness center will take over, and levels after that, the health insurance will cover. So that's how they envisage the importance of having a cashless health insurance scheme up to 5 lakhs to 10 crore poor families. 1,200 crore for Ayushman Bharat program. They are planning to set up, as if you can see in the next column, it's about 1.5 lakh health and wellness centers to be set across the country. We need manpower, material, we need resources. So the government has dedicated this 1,200 crore and has also promised to give it every year for the sustainability of the program. 1.5 lakh health and wellness centers to be set across the India. And to our wonder, they have given that every health and wellness center can be also be headed by a nurse. And that is a CHO, community health officer. So I will come to that, and probably Janie ma'am will be dealing in detail on it. And a 600 crore for nutritional support to all TB patients. See, again, there were a lot when we started doing COVID pandemic duties. Healthcare services were given. Many of the tuberculosis specialists or chest physicians came and said, "You're taking so much of effort for this, but why not? Why, if you have done this for the TB, then we would have reduced the number of patients with TB and prevented the spread of TB." So that is when I think this has been realized by the national government, and that's how it's very important that TB patients get the correct nutrition for them to, create immunity with them and fight the disease. So a 600 crore for nutritional support to all TB patients have been dedicated through this program, and 1 government medical college for every 3 parliamentary constituencies. I think why this government medical college? Because you'll have a tertiary care hospital, and you'll have you'll have manpower being developed on one end, and you have tertiary care hospitals which are developed, so that the tertiary care is also enhanced for our people here. So as I told earlier, Ayushman Bharat has 2 very, very important pillars. The first pillar is a health and wellness center, and the second pillar is a Pradhan Mantri Jan Arogya Yojana. It is called as PMJ scheme. That PMJ scheme only we spoke about this 5 lakh rupee as health insurance. Now, the first component of health and wellness centers, 1.5 lakh centers are being envisaged to be developed. We have nearly done about 1/3 of the centers have been set up, and it is universal, it is free for people, and it focuses on wellness and the delivery of an expanded range of services closer to the community. Now, are they going to set up a new health and wellness centers apart from sub-centers? No, sub-centers will be converted into health and wellness centers, and their major goal of health and wellness centers, they are going to enhance and empower people there so that they'll be able to provide primary health care. So people who require primary health care, For example, a person with fever and cold should go only to a primary care. If he stands at the tertiary care hospital, utilization of available resources is not happening. One, two, their transportation cost for the patient is going high. Three, actual people who need to receive care at the tertiary hospital is being denied of the care because already this person who can be treated at primary is standing at the tertiary healthcare center. So this is why this component of health and wellness center has been created to provide comprehensive primary health care, which we spoke about: preventive, promotive, curative, rehabilitative, and palliative care services will be given through this health and wellness centers. The second component is the Pradhan Mantri Jan Arogya Yojana scheme, which is a 5 lakh coverage per year to over 10 crore poor families for vulnerable people for receiving secondary and tertiary care. See, that's the government thoughtfulness. They said primary, you receive it from health and wellness center. If primary gives you the referral for secondary and tertiary care services, then you can use your PMJ scheme. The card will be given. You have to register for the card and get the card, and that card you can utilize for cashless services at the secondary and the tertiary level. So these are the key components. So let's see the health and wellness components. See, there is expanded service delivery is there, expanding HR and multi-skilling. That is, it's a teamwork. Health and wellness centers, because you have telehealth, you need a lot of community participation. You need a lot of, implementation processes are very high. You have to connect because everything is on online database. Now, everything is through the tab. They have to do the entry to the tab. And from the health and wellness centers, you'll be able to identify the statistics at the national level itself. So that's how the system works. So the key components are service delivery, the expanding HR and multi-skilling. So if you have a person in the health and wellness center, their role will not be only what they are being trained for, but an additional training on multi-skilling will be given. Partnership for knowledge implementation, local NGOs, local volunteers can be brought in to do the partnership. Partnership with food and labor organizations can also be done. Community mobilization and health promotion. Very important is that creating health awareness and robust IT system, because as I told you, everything is going to be on a database. Financing and provider payment reforms. So it's important because through health and wellness centers, they have to receive the resources from the national government. Medicine and expanding diagnostics. So the first level of basic tests can be done at the health and wellness center. Any extended services, they can be sent to the secondary care center, which might be a CHC or a district hospital, etc. Continuum of care is referenced. So there is a continuum of care maintained, which I will explain it in my next. If you can see this, the expanded service areas, maternal and child health is already existing. That is going to be there. Adolescent health is going to be there. Geriatric health is going to be there. Our focus is going to be on mental health as well as the family. Whole family services are being covered. That is the expanded package of services. The next one is the health promotion scheme. So here, the International Yoga Day, which we are conducting, this has become very, if you can see, this image has become very popular among the government sectors, and many people use it. We also used it for our international conference, because it talks about what and all is required for a wellness for promoting wellness in an individual. See, the first one is, say, the yoga. So all of us know June 21st has been considered as a International Yoga Day, and lot of activities are done across India to sustain the need for having a balance between the mind, the physical body, and the mind and the soul. So that connectivity they are trying to bring in. Importance of rest, importance of nutrition, importance of exercise, and to keep yourself, keep monitoring your health. So these are the health promotion and wellness strategies that the Ayushman Bharat is looking at. And reaching the last mile. The transportation services are free of cost when you are doing referrals. So no money is being charged for, or they don't need to pay for any of the transportation charges. Everything is free of cost. And very another important, it is a team-based approach. So everyone, they have their defined roles and responsibilities, but they are being taught about multitasking and multi-skilling also. So this way, they are able to be a part of the team and work as a team. And ensuring continuum of care. Continuum of care, they start off from the village and the urban, at the village level care. that is a sub-center serving 3,000 to 5,000 population. You have a PHC which is covering this. Is there any difficulty? Am I audible now? Okay, ensuring continuum of care. Janie ma'am, am I audible?
Yes, ma'am. Yes, ma'am.
Yeah,
You're
yeah.
audible. Audible.
Okay, okay.
You're audible, audible.
Yes, yes.
Yeah, yeah, thank you, ma'am. The village, see, it starts from the sub-center, which serves 3,000 to 5,000 population. And this 3,000 to 5,000 population, you have about it's five to six sub-centers are covered under a PHC, depending on the plain or a tribal area again. And there, once all required promotion or wellness or prevention aspects are done at the village level. And that is done by the Ashas. We have Ashas, or in certain areas like Tamil Nadu, we do not have Ashas. We have the ANMs who are there, or we have a health worker female who is there, who will be doing that responsibility. That based on the state policy it is. Next, if they are not able to be managed at the village level, the next continuum of care is a health and wellness center. We said the sub-centers are going to be converted, that those health and wellness centers will act as a first level of care where primary care is being taken, and that acts as a prevention of wasting of services at the secondary and tertiary care. So the primary care, what and all can be covered will be covered there. If in case the CHO who heads the health and wellness centers, they are called as community health officers. Now these community health officers could be nurses, could be Ayush practitioners. So these people they will be as community health officers, and their roles and responsibilities will be explained by Janie ma'am. So they will be there to identify, take a decision, take a call that they can be managed at the primary level. If they cannot be managed at the health and wellness centers, they have to write a detailed referral slip and pass on this referral slip to the primary health center or the urban primary health center or the CHC or the district hospital or specialty hospitals based on the requirement of a person. Not necessarily they have to, the next referral should be only a primary health center or an urban primary health center. If suppose the health and wellness CHO decides that tertiary care is the next requirement, they can be given a referral directly to the district hospitals, to the CHC or to a specialty hospital. So this continuum of care is well understood, and I mean it's well written down, and it is easy for the health workers who are heading these centers to take decisions, manage decisions at based on the patient's conditions. So as I said, if this whole thing has to be coordinated, without a team, it is not feasible to do this, to make it a reality for Ayushman Bharat to be successful. So what are the expanded range of services? As I told you earlier itself, care in pregnancy and childhood. So from the antenatal booking, regular checkups can be done at the sub-centers itself. So regular checkup can be done at the sub-centers itself. Only if there is some alarm call requiring for any checkup or something, they can be referred to. Neonatal and infant healthcare services, growth monitoring programs can be done at the health wellness centers. Childhood and adolescent healthcare services, again, under 5 care, adolescent healthcare services, people who are CHOs have the capacity to even do counseling in the health and wellness centers. Being that such case, I think adolescent counseling and all is possible at the health and wellness centers. Family planning, contraceptive services, and other reproductive healthcare services can also be done. Even insertion of an IUD can be done at the health and wellness centers. Management of communicable diseases, national health programs. See, national health programs, they have a range of objectives and activities which has to be carried, which will be carried out through health and wellness centers. Management of common communicable diseases and general outpatient care for acute simple illnesses and minor ailments like acute respiratory infection or a fever or a urinary tract infection or an gastroenteritis. All these can be handled at the general OP care. So most of the services, actually it has been told that only most of the care at the primary health center, that is a sub-center and PHC, is underutilized. The reason for this Ayushman Bharat to come out as a transitioning subject was that this underutilization, so much of money is being pumped into this healthcare system, but the utilization of services is very, very less. And that is why they thought they'll strengthen the primary level so that we can talk about illness prevention earlier and prevent people to become patients in the future. So OPD care, where 72% of the money is being spent on private sector. Now, even if you go to a village, in where we serve, 55 villages we serve. If you go there, there are so many private practitioners who come for 1 hour and they go. And when the PHCs are available, there should be a lot of motivation talking to be going on by community health experts, by our students who are working in the community, by our own people there, to talk about the care services, because most of it is unawareness. They are not aware that such services are available in government PHCs. I think it has to be told down. It has been planned at the top level, but if it is not being communicated at the grassroots level, it is very difficult for utilization to happen, because it is our own money which we pay as taxes are being utilized there for the PHCs, and we want our people to utilize those services. So I think we must be advocates for our community people, telling them, why do you want to go spend that consultation fees of 200 or 300 there? Government is giving you this as free of cost. There is a specialist. People who sit in government rankings are all specialists who pass a medical recruitment board exam. They are highly intelligent. The nurses who are sitting there are coming through MRB. All these people have the authority, have the competency, knowledge and skill to provide the services. So you must be able to, as community health experts, we should be able to tell people that all these services are available at nil cost. There is no cost for that, and tell them to utilize this. Screening, prevention and control of management of NCDs. I think we were talking about chronic communicable diseases like TB and leprosy, as I told earlier. We were dealing with these diseases, but NCDs, which are silent killers, most of now in COVID itself, if you can see, people with diabetes and hypertension are at higher risk of mortality and morbidity than people without the non-communicable diseases. So there comes the fear factor. For any kind of diseases, NCD will become a target, because the immunity is compromised, the metabolic system is disturbed, and that is where we have to think about controlling these diseases. So diseases have come, but how to control it, how to manage it? There are a lot of programs which are there, which can be used as a model, and it is only the CHO who has to take the lead. There is no hard and fast rule that you should not put up a best evidence into practice. CHOs should have the knowledge to bring in best practices to your health and wellness center, so that your community is benefited. So basic oral health care, again, oral hygiene, that's another important thing. And basic oral health care can be done. Care of common ophthalmic and ENT problems. I'm sure all of us know how to use a Snellen's chart. As B.Scs itself, we are being given an opportunity to identify the vision using a Snellen's chart. You can use that Snellen's chart and identify the vision. And basic ENT problems, but which you can do through inspection and palpation itself. We can identify the diseases. You can use an otoscope to identify if there's any cerumen impaction or there's any infection. So all that can be done by a CHO and the health workers who are there in the health and wellness centers. So I think these common diseases which can be handled so for which we pay consultation charges in a private sector, we can go without cost in the government sector. Elderly and palliative healthcare services, home-based services for palliative care, giving them comfort, giving them advices to how take care, bringing in a non-governmental organizations. So there are many organizations like Jivodaya, Can Care, who are providing free services for palliative. This is where partnerships are required, where for elderly, trying to bring them some devices which will help them make their comfort better or relief in pain. So those kind of services can be partnered, community mobilization of partnerships and services to our people. I think that is where health and wellness centers act as a major thing, so that these people cannot travel all the way for 25-30 kilometers to reach a tertiary care hospital. Emergency medical services, availability of ambulances, in case of immediate CPR and first aid reviving, that is available at the health and wellness centers. Screening and basic management of mental health ailment. All of us know how to do a mental health screening. An MSc, a mental assessment examination, all of us know how to do that. So as CHOs, we are being empowered with the skill and competency. So many primary care aspects can be done, inclusive of mental health, can be done at the health and wellness centers. So next come who are going to be a part of this team. So if you take at the sub-center, you have a mid-level healthcare provider who is a B.Sc or a GNM or an Ayurveda practitioner. That Ayurveda practitioner should be trained in 6-month certificate program in community health or community health officer. Now again, I understand Kerala doesn't have the 6 months training program, nor do they have a post of an MLHP in the sub-centers. Same way it is in Tamil Nadu. But if you go to Andhra, I attended a meeting at New Delhi where they had the system NHSRC director. She came in and she spoke about MLHP the CHOs performing excellently, and most of the places in Andhra, Orissa, Assam and all, it is the nurses who are being placed as CHOs. But unlike them, they have taken a 6 months training program. But for us, now we have given an opportunity. The Indian Nursing Council has given us embedded that in the curriculum of 2019-20 in the final year itself. People have to undergo the skill. There are 43 sets of skills which we have to undergo, and this 43 sets of skills, if they are thorough about, then they can be put into the stream of CHOs. I'll just show you a book. Vijay, book it in. Now, I think you can see this. This is the Tamil Nadu Nurses and Midwife Council has put this book. It is a mid-level health provider logbook. Now, the 6 months program has a logbook which says every skill has to be repeated 4 to 5 times. But now, what we have done is all of us have already done it in a B.Sc curriculum, but still to make sure that these people also conduct this skills in the community, in the primary health center, in the sub-center or the specialty hospitals, we have given them a logbook. The Tamil Nadu Nurses and Midwife Council with the expert committee has put up a logbook and given to each and every individual who was passing out of 2019-20. So they will have this logbook in hand. This logbook tells about all the formats of how every care aspect or skill aspect they have to learn is being given there. So that's about the MLHP who will be there, and the multi-purpose health worker female and multi-purpose health worker male, and we have 5 ASHAs as outreach team per SHC. So next in the PHC, you have a PHC team. There should be at least 1 MBBS, 1 doctor, MBBS doctor, 1 staff nurse, 1 pharmacist, 1 lab technician, and a lady health visitor. Here we call as an ANM in Tamil Nadu. I'm sure there should be another replacement there. And multi-purpose workers and ASHAs is also available. In Tamil Nadu, we do not have ASHAs till now. So services are the Indian Public Health Standard. I don't know how many of you are aware of it. The Indian Public Health Service Standards are there for people who are working at the SHCs, primary health centers and CHCs. So these are given. Already there's a set of services which are given. In addition to that, the screening of CDs and wellness is also being added on in the health and wellness centers at the PHC level. Now, how does the facility management? For example, we said 4 levels of referral, we said. At the village level, the sub-center level, we have the PHC level, and then we have the CHC level. So the 4 levels, what do the ASHA or the multi-purpose worker or an ANM do at the village level? They do population enumeration, they do outreach services, they do community-based screening, risk assessment, awareness generation, follow-up on confirmed cases, counseling, lifestyle changes, treatment compliance. See, the last part is very, very important because that is where our promotion aspect comes in. All the others are identifying if there is a disease, but the last part of it shows that we are very concerned with the lifestyle behavior, the change in lifestyle behavior to be brought in. And our role is to keep talking to people and keep, creating an awareness that this is a healthy lifestyle, follow it. This is how we have to do. Try to do exercises. Recently, we were given funding from our State Nursing Council for one of our research projects to see the effect of a community gym. This community gym is not all those heavy things what we have. What they do, they use these ropes They use the well drawing, water drawing from the well. So these are the things we have created in the community, and seeing how, what an impact it has on the wellness of a woman. So that is focus. So that way CHOs can guide the ASHAs or multipurpose health workers to think about how to bring in this awareness concept among our people and change the lifestyle which is healthy. If they have a good lifestyle, tell them to follow the same. If the lifestyle, identify practices which are harmful in their lifestyle, only focus on that and try to manage it. So it has to be a family-based continuum care. Next comes the MLHP, that is a mid-level healthcare provider, or we call them as, after their training on MLHP, they'll be called as a CHOs. So CHOs are the first level care. They do the screening if they come with a problem. They use a diagnosis, so they'll be able to do diagnosis. They will have a formulary from where they can do the drug dispensing and record keeping, telehealth, referral to medical officer at PHC for confirmation and complications. Now there are so many services which are WhatsApp based, which are connected to tab, and your IT facility telehealth services are there. So if you have a problem with the patient and you want to confirm if this is that, you can make the patient sit there, do the screening, scanning of the services, and relay to the medical officer in the PHC, who will give an advice, and based on that, the treatment and consultation can be given. So till that level of telehealth services are available at the health and wellness centers. Next is the PHCs, which talks about diagnosis, prescription and treatment, referral of complicated cases, telehealth, and real-time monitoring. Advanced diagnosis in the CHC, complication assessment, telehealth, and tertiary linkage. These services are the same as per public health standards, which we are doing. So now if you see this triangle, there is 3-tier triangle which is there. The lower ones, which are unmet needs, that is called the primary. So I'm sure by now all of you will be aware that this primary is being taken care by the health and wellness centers, which is the first pillar of Ayushman Bharat. So all the unmet needs of the person, the non-communicable disease and other chronic communicable diseases are taken care. This is done along with the existing RMNCHA. I'm sure all know that RMNCHA is reproductive, maternal, neonatal, child health, and adolescent health. So it covers the existing RMNCHA along with the NCDs. From health and wellness centers, if it is not, the CHO is not able to manage the people at the health and wellness centers, then they are being referred into the secondary and tertiary level. And that is where our PMJ scheme comes. The Pradhan Mantri Arogya Jan Yojana scheme, the 5 lakh cover. So when people are referred to the secondary and tertiary level care, they don't need to again pay for the services. Now, is it only at the government hospital? No. They can use this card at any empaneled hospitals like other insurance companies which give. So for example, if there is in Tamil Nadu government, we have many empaneled hospitals like Triple M Hospital, we have at Sundara Medical Foundation. There are many hospitals. Vijaya Hospital provides this PMJ scheme. So you can use this card to take the services. For example, you come from Kerala, you come to Chennai for certain reasons. You are here. You might have only one card which you can use it at any state. This card is not restrictive to only the state where you are from. This card can be utilized in any state in India. So it is pan-Indian health insurance card. So you can use it anywhere. So for any secondary, you will need to have a surgery, or you need to have some diagnostic services, or you need to have palliative care services or rehabilitative services, then you can go to the tertiary care hospital and you have a cashless treatment. Just show the card. So how will they do? So what and all services are there? Health cover for 5 lakhs under PMJ scheme. Priority to the girl child, women and senior citizens are always there. Pre-existing diseases covered. Now, most of the insurance companies, they might ask you, suppose you had a lump in the breast removed, okay? And you put that, you very frankly write it in the, did you have any surgeries earlier? And we write that in the, it happened to me. So when I wrote that there, they denied to give me a health insurance scheme for me, because they said I am prone for getting problems later. So they don't want to take that coverage. So that is how private insurances are there. But now pre-existing diseases are covered under the CMJ scheme, access to paperless and cashless healthcare, support and coordination by the Arogya Mitra. See, Arogya Mitra is, if suppose I'm here in Chennai, I'm in a place called Ambattur, if I get connected, so to one of the PHC or the sub center which is there, I can have a specific person who I can contact with. That is called as a Arogya Mitra, a friend who's there or a person who's there to help you through your health. So that person will connect with you to provide you the information related to healthcare services. Benefits available across India. As I said, it is not only in one specific state, it is across the state in India, and families listed under the Socio-Economic Caste Census Council. So if you are coming under the SEC database, then you are eligible for this PMJ card. Now, how many of our people living in the community have a PMJ card? I just, when I was went to the community for my kiosk program for NCD, when I asked them, all of them have the health scheme of the state, which is for 3 lakhs or 5 lakhs coverage now. But none of them had this PMJ scheme. So we were trying to tell people that this insurance can also be taken, because if your name is in the SECC, you are eligible and it is always going to be useful. We had one child who underwent the surgery through this PMJ scheme at one of the hospitals in Chennai for a heart surgery. So I think that is also comes under she had a PMJ card, and it was easy for us to undergo this closure of the ASD valve. So process of availing, how do you avail the process? First, there is patient hospitalization. You don't need to pay money initially, because that's what we do when you go and admit. So you do a hospitalization. You identify the beneficiary from your list of PMJ registrations. A pre-authorization, the empanel hospital has to send a request to the government. The government will then do a pre-authorization. There are people who have taken as a like subcontract for the health insurance schemes. Then a treatment is done and discharge is done. After that, the hospital has to claim this request and settlement for the services which has been made. So this is how you can avail a PMJ scheme. So what is the benefits? As I said, all uncovered hospital expenses with ease. You can do that. There is cashless facility. Yes. Yeah.
How many more minutes do you want, ma'am?
I just need about 5 minutes.
Okay, thank you, ma'am.
Yeah. It covers the transport allowance of the beneficiary during the pre-hospitalization and post-hospitalization, daycare expenses, pre-existing ailments, as I said. All these we have discussed earlier. So this is the progress which in 2019, this is a 2019 census which I have. So if you see on the left side, you can see the footfalls. Okay, and number of yoga and wellness centers, 2,03,727 yoga wellness centers have been conducted. The footfall shows the 3,10,92,556 people have come and visited the health and wellness centers for services. 69,41,000 and odd people have taken hypertension patients are availing treatment from health and wellness centers. 38,17,000 people are taking treatment for diabetes under this health and wellness scheme. Number of people screened for cancers. For breast cancer, we have 82 lakh people and odd who have been screened. For 49 lakh people screened for cervical cancer, and 1,22 lakh have been screened for oral cancer, which is all under the health and wellness centers. All this is the outcome from a health and wellness center set up by our government. So in conclusion, I would like to say that the Ayushman Bharat Health and Wellness Centers will have a major impact on quality of healthcare provided, because we are looking at prevention and promotion. Whichever health system project focuses on illness prevention and health promotion, then I am sure the quality of healthcare is going to be 100%. It will make all levels of healthcare accessible. So earlier it was only primary, preventive and promotive services. Now even till palliative care services, health and wellness centers are going to provide. So healthcare is going to be accessible, and the PMJ scheme will make the vulnerable also to get the services, and nurses will also be the CHOs. I think this is where nurses bridge the gap in the health system. Nurses are going to be the change makers. Ayushman Bharat is considered as a change maker because it is going to try bring in health wellness concepts and health promotional concepts And that too, the achievement of SDGs and UHC is going to happen because of a nurse who's going to be heading as a CHO of the health and wellness centers. So I really believe that the B.Sc nursing students who are witnessing this webinar or being a part of this webinar understand the importance. Once I finish a B.Sc, I am eligible to become a community health officer. So that passion towards people and community, people skills are very, very important wherever you go. But having that skills towards health is very, very important. So you have a very major opportunity awaiting you to work as a head of a health center who is going to think about, who's going to bring in changes in the community for primary health care and promotive care. So with this, I thank the organizers for giving me the opportunity and the people for a patient listening. Thank you so much.
Thank you, ma'am. Ma'am, you took us to the Health and Wellness Center, I feel. The aspects, and you shared from your knowledge. It's really a knowledge bank from where you have. I think you are a member of Tamil Nadu Dr. MGR Medical University Senate member, where all these things. I think we wouldn't have got somebody else who would share all these things. So thank you so much, ma'am. It's not only benefit for the students, the faculty also. We also have a lot of benefit from all the aspects what you have taught. So thank you so much, ma'am, from the bottom of my heart.
Thank you.
And
thank you.
Participants, please do put your questions in the question and answer box at the end of the session. Ma'am, is it okay for you? Can we have it at the end?
Yeah, sure.
Okay.
I'm here.
So please do drop in your questions to the question and answer session. Okay. Now let's go to our next speaker, Dr. Janie Kemp, Principal, GNKM Nursing Institute, Coimbatore, who will be talking about MLHP, a chance or choice for nurses. She has pursued a PhD from Annamalai University, and she's an alumni of both UG and PG from Ramakrishna College of Nursing, Coimbatore. She started her career as a clinical nurse in ICU of Madras Medical Mission. And after a short span of 9 months, she went into this teaching profession. And I think it's almost 29 years, if I'm not wrong enough, ma'am. And for the past 11 years, she is an administrator, that is the principal in this college, GNKM. And lot of awards like Kanchana ma'am itself she has received. And I think if I go on saying, we'll be missing the content. So a few awards, she was the recipient of the best student nurse. So we can know that from the student life, she has received, and in her UG, in her PG also she has received the best outgoing PG nurse and the researcher, and best nursing leadership award by the Education Today. It's a magazine in Tamil Nadu. And she's also not only administrative, professional activities also she's very good in. She has held the positions like President of TNI Tamil Nadu chapter, and now she's the Vice President of South Region TNAI. She has also published and presented various scientific papers, and her passion is a good organizer. She's a very good moderator, okay? And more than that, she's a good astrologer also. So after the session, if anybody needs to know about your stars and all, you can contact ma'am. And she's a very friendly person. Thank you, ma'am, for all this. And so now the platform is yours. Janie, ma'am?
Oh, thank you so much. Can I share my screen?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am. 1 second.
Can I?
Yes, ma'am. It's not yet shared.
Just give me a minute.
Yes.
Just give me a minute.
Yes, ma'am. Yes, ma'am.
Okay, fine. Can you see
It's
my
not
screen
at,
now?
it's not at share screen. You click on
You
to
have to,
share screen, open
yeah,
your
yeah.
file.
1 minute, 1 minute.
Yeah. It's coming.
Yes, now
It's not,
is it
yeah,
visible?
yeah, it's visible. It's visible and clear.
Okay, very good
Yes, ma'am.
morning. And I immensely thank the Pushpagiri College of Nursing for having identified me as a speaker for this virtual platform. And I thank the management, the principal, the vice principal, and Sony, who has been constantly coordinating with me. It has been wonderful. And I think most of the talk was done by Dr. Kanchana. She's an expert, and I always feel she must be the head of this program at the national level. That's what I aspire for you, Kanchana. And this webinar is one of the best so far because it is preparing the student nurses for the MLHP. Okay. I like the topic, the very topic of this webinar, MLHP Initiative for Student Nurses. Aptly chosen, very correctly chosen at this time of the day or the minute or whatever you say. Okay. Every nation regard their health as the most important component. Okay. Health of the nation is more important than the wealth of the nation. And believe me, every nation has been concentrating more on the mother and child because they are the human capital or they are the human resource. If the mother is healthy, the baby is healthy, and it's a cyclic process. It goes on. Okay. Now, this universal health coverage, it was probably after the Second World War when it was announced, and rightly in 1948, it meant that health should be we must make sure health reaches everyone and everywhere, the nook and corner of the world. That's what we mean by universal health coverage. And what did we in India do about this universal health coverage? Right after our independence, or even before our independence, when we knew we were going to get our independence, the Boer Committee, 1946, the first ever health committee, then the Alma Ata Declaration, 1978, for primary health care, then the National Health Policy, 1983 and 202, and the 12th five-year plans, and now the National Health Mission. All of them have made their best contribution or studied and survived about the health of our nation. And believe me, National Health Mission is a flagship program of our country. When we say flagship, it means this is the best. And through this National Health Mission, we can reach everyone everywhere. Okay. Now India has come out with something called Ayushman Bharat. And I hope all of you know what Ayush means. It means long live. And Bharat is, of course, our country, India. And we want everyone to stay healthy and live healthy. That is the motto of the Ayushman Bharat. Okay. Now, the history or the origin of MLHP. As I told you, it is universal health coverage, which every nation wanted it right from after the Second World War. And India launched Millennium Development Goal in the year 2000 with 8 goals and 21 targets. And then we had Sustainable Development Goals, which was launched in 2015 with 17 goals and 169 targets. 8 goals may look very small to all of us, and 21 target also may look small. But when we were not able to achieve these Millennium Development Goals, then came the Sustainable Development Goals. And the goals became bigger, larger in number, and the target became larger in number. When we want to achieve these goals and targets, we must have special health workers to achieve this. We cannot go on with the same existing health workers and try to get a better health outcome. And that is how this MLHP program came into existence. Okay, they wanted some health worker who's easily available in the community, who's easily accessible in the community, and who's easily acceptable in the community, and they must be of some quality. That means they must have some form of education. That is what they want. Means a human resource. And in the next slide, I'll be able to tell you, like in the North India, and in order for us to advance the Millennium Development Goals and to attain the universal health care, we have to have more human resources, and that is how the MLHPs were born. That is a new cadre, the MLHP, which was introduced by Ayushman Bharat, the mid-level health provider. And here we have the MLHP, who's the nurse, and we must be thankful to the government for opting the nurses to be the MLHPs. I don't know how many of you are aware, this year is the decade of strengthening human resources for health. And from 2015 to 2024, and definitely all we nurses have a lot of opportunities in the government, and we must make sure we grab these opportunities and showcase our talents, our knowledge, our competency in bringing health for all in our nation. And when we act locally, and I'm sure we'll able to have an impact globally. Now, why this topic? And I thank Sony for having given me the liberty to coin the topic all by myself. And Sony, thank you so much. And the topic given to me is MLHP, a chance or a choice for nurses. Okay. Now I'll be explaining the meaning of all these words just to make things very clear for you. Okay. Now this MLHP. ML is mid-level and HP is health provider. So you have two different terms. Okay, excuse me a minute.
Oh, yes, ma'am.
Just a minute. Okay. Yes. So mid-level means someone, and as a health provider, I told you there are two different terminologies in this. Mid-level means the link, the person who's able to create a link, a person who's able to bridge, and the intermediate, that means in between. At one end there's somebody, then the MLHP is in the center, and there is another person at the other end. Okay. And health provider is anyone who's trained and is given permission legally to practice healthcare. Okay, that is what we mean by a health provider. Okay, there are a lot of synonyms for the MLHPs, and they call themselves mid-level practitioners in some states, MLP, and you have community health provider, CHP. Then you have nurse practitioner, which is very common in the abroad countries, clinical nurse specialist, community nurse specialist, and so on. But the best is community health officer. And that is what I'm very fond of, the community health officer, CHO. So I'll be using these terms CHO more often. And you must be aware that this is the MLHP who's called the community health officer. Okay. Now, I'm not going to give you the definition here, and it was introduced by the National Medical Mission Bill of 2019, and there was a lot of opposition for having introduced this bill because it was the chance was given for the nurses. And let us not talk much about it, but let me tell you, you're not doctors. Okay, first remember that we are not doctors, but we need to take a training in college or in a university. That is a recognized state council, university, or college where you undergo your B.Sc nursing or post-basic B.Sc nursing. And we prepare you to work autonomously. That means with the decision making, the planning, the execution, everything is yours to diagnose, to treat common health problems, to manage emergencies, and to refer appropriately for further care. Okay? Now, the other subset of my theme was whether it is a chance or a choice. Chance is a verb and choice is a noun. Okay? Chance means, do you have the possibility to take up this job of CHO? Or probably you can, when you're trying many other jobs, this can be in your mind. And choice is an option or an alternative. Okay, you do not want to work in a clinical area, then you switch over to the community. Okay. Now, 2020 is a really lucky year. As Kanchana said, this year is dedicated for the nurses and the midwives. And not only that, all the B.Sc nurses, the first batch of B.Sc nurses and the post-basic nurses who are passing out this year, the mid-level health provider course was introduced in 2019-20, and all of you will be passing out this year, and we're going to have a lot of you applying for this course. Okay, and a lot of you may apply, but only some of you may pass. Okay, so I really want all those who appear to have a good percentage of marks so that they consider you when their vacancy arises. Okay, now from now onwards, for all the nurses who are the final B.Sc nurses who are seated in their home watching this virtual screen, I want all of you to aim for the CHO job, which is a government job. And at a very young age, you're going to have this job and you're going to be a real administrator. You're going to be a supervisor. You're going to be a teacher and whatnot. And the community, remember that. Okay, your primary role, just have a look at this picture. What is this picture telling you? It is going to bridge the gap. Okay. Now you will have to bridge the gap between the community and the healthcare facility through your comprehensive primary health care, which Kanchana has spoken in length and breadth about comprehensive primary health care. Okay. And where are you going to work? Your setting is going to be in the Health and Wellness Center. And what is Health and Wellness Center? It is the upgraded sub-center and the upgraded primary health center. These are known as the Health and Wellness Centers. Okay, this is where you're going to work. And believe me, the government will be upgrading around 150,000 sub-centers and primary health centers. So there are a lot of opportunities for all of you to take up a job as a CHO in these centers. Okay. And the principle behind this Health and Wellness Center is to make sure the care reaches the person within 30 minutes or less than 30 minutes. That is why the sub-centers and the primary health centers are upgraded. Okay. And the preventive care, the promotive care, the secondary care, the tertiary care, whatever care is possible, because your health and wellness center is really going to be equipped from now onwards for you to provide all these care. If you're not able to do something, only then you're going to refer the cases. Okay. So you are knowledgeable, you are competent enough to take care of the people at the upgraded primary health center and sub-centers. Okay, now already Kanchana discussed about the health the services provided by the Health and Wellness Center. I will just run through it. It is care in pregnancy and childbirth. You're going to give a neonatal and infant health care. There are about 12 subsets. Okay, childhood and adolescent health services. Then you have the family planning, contraceptive and other reproductive health care, management of communicable diseases, including national health programs, and care of non-communicable diseases. And then you have the management of common communicable diseases and outpatient care for simple illness and minor ailments. And of course, screening of mental health ailments, childhood and adolescent health. I'm sorry, it is ENT, I and ENT. I'm sorry about it. Then you have the basic oral health care, the elderly and palliative health care, and emergency medical services. These are the components, or these are the services which will be broken down, and you will have to make sure the person or the individual who's coming to your wellness center is given care completely, and for them to seek secondary or tertiary care must be minimized, because your care should be that powerful or that excellent at your center. Okay. Now, what is the main skill set you require when you become a CHO? Okay, just 3 things, but it may look just 3, but make sure you become competent in all this. It is a clinical set. Okay, clinical skill set. Then comes your public health skill set. Then, of course, your administration, because you are going to govern the health and wellness centers. Okay. Now, the next few slides will be all about why you have to take up this course as student nurse, what you have to do to get into this job, and how you're going to get into this job, and when and where you will have to take up this job. Okay, this is only about that. I'm going to talk in very simple language so that it reaches all of you. The first thing, this COVID-19 has been a blessing in disguise for all the students. But unfortunately, the final year students, you have to attempt your exams and you have to pass through. Okay. And I think that is a good enough decision by the government, because only then we know the competency of the healthcare workers. So B.Sc nursing and the post-basic B.Sc nursing students, you must do very well in your community health nursing, which is in your 4th year, and in your 3rd year you have part 1 and part 2, and post-basic in the 2nd year. And as Kanchana Malini said, there are 43 procedures which we are very proud the Tamil Nadu Nurses and Midwives Council created a logbook, so that when we get into this job of a CHO, we can submit this as a profile, and we'll be proud that we have gained competency in all these skill sets, and we are capable of what we really can. So now exams may be in the month of October or in the month of November. I want all of you to really pass with high grades, and so that you're able to apply for this post. Okay, immediately after you do your exams, the first thing what you should do is you must register yourself in your own state. Okay, where you studied. I mean to say where you studied. Suppose you have studied in Tamil Nadu, as if you're from Kerala, make sure you register yourself in Tamil Nadu. Then later, if you get a job as a CHO in your own state, that is when you need a reciprocal registration. So mandatory that you register for yourself in the state where you're studying. Okay. Then, of course, this job is very lucrative, very nice. It's a government job at a very young age. You are a government officer, but make sure you have an aptitude, because you have to be with the community and you have to do a lot of interaction. So decide for yourself whether you want to be in the community or in the clinical field. Okay, that means in the hospital. Okay, now this aptitude, now you may, yes, you can. Okay, you can, because there are a lot of webinars also going on. There are a lot of courses in the internet where you can build your aptitude, and that's how you can pass through if there's an aptitude test, if so ever, when you're applying for any course or any kind of job. Okay. You must remember when you are a CHO, you're multitasking because you have to exhibit your leadership, you have to exhibit a managerial skill, and you have to do a lot of supervision, and you must make sure the continuity of care is there throughout wherever you are. Make sure the patient gets the care at your sub-center, and if he's been referred to the primary health center, the block level or to the tertiary care center, you must make sure you have a track of that patient all through. Okay, so you'll be multitasking. So if you do not have any of these skills, it is time that you do your homework right now when you are at home. Okay, every learning takes place at home. Remember that this COVID-19 is a blessing in disguise, and you guys can really develop your skills whatsoever you want, wherever you are right now. Okay, then you may think Kanchana madam told about an additional qualification. Yes, there was an additional qualification, which was a bridge program in community health for nurses by the IGNO, which was a 6 months course. Okay, this was introduced some time back, but unfortunately, there were very few nurses and very few Ayurveda practitioners who took up this course. And the output of the MLHP were very less. So that is how the government in the National Medical Commission bill, they said we want more number of MLHPs, and that is how the course was introduced in the year 2019-20 into the B.Sc curriculum and post-basic curriculum. And now when you qualify yourself as a B.Sc nurse or a post-basic B.Sc nurse, you can apply for this course even without undergoing this bridge program. Okay, so make it very clear. Now you've completed, now imagine yourself, you have completed your B.Sc nursing or post-basic B.Sc nursing, and you have registered yourself. Now you will have to look out for MLHP recruitment. Okay, for MLHP recruitment, there's a national portal which you can please note it down. You can note down this, you can go through this. Okay, and in Kerala, as Kanchana said, there is no MLHP opening. But when I went through the website, there's an Arogya Kerala, there was an MLHP word mentioned. And unfortunately, in Tamil Nadu and in Kerala, we do not have this opening. And I'm sure with the blessing of God, maybe in the coming few months, with the stakeholders knowing the importance of nurses, we will have an opening. Okay. And Karnataka has been doing wonderfully well. They've given a lot of opportunities for nurses to take up this MLHP, and they are now the community health officers there. And the same thing with Andhra and Telangana, and most of the northern states have this program. And if you're not able to get through this portal, you just go into your state job portal. That means if you're in Tamil Nadu, just go to Tamil Nadu job portal and you'll be able to find what are the job eligibilities criteria or the vacancies available, and you can go ahead like that. Okay, so it's very important you log in. Okay, and please read the newspaper once in a while. I always tell my students, okay, the newspaper is not going to bite you. It has got a lot of information, because some of the advertisements of MLHP comes in the newspaper. For example, in Karnataka, it was a newspaper advertisement, and that is how many of them came to know about it. And you will have the criteria, everything there, and you can apply for it immediately. So keep updated with the, your job vacancy. And if you're aiming for the CHO job, read the newspaper every day, log into the state job portal and find a way for you. Okay, next is identify a mentor or a role model. Okay, believe me, there are more than 11,400 community health officers who are nurses. A total of 15,000 MLHP workers are there, and we must be really proud because we are 11,400 and odd nurses who are holding this post. Okay. Now, I want all of you to sincerely go through this YouTube connectivity, which I'm giving you right now, because in the month of August, there was a webinar on career advancement for student nurses. And believe me, there were some rock stars, I must say, who are community health nurses who have spoken so well and who have brought about a change in their own community. And it's a one-hour webinar, and you can identify the person there who are presenting and ask them the details if in case you want to become a CHO. Okay, this is a virtual career orientation which the webinar was hosted on the YouTube, and this is the link which is available for all of you. And I definitely want all of you to go through this, identify one mentor there, and if you want to become a community health nurse, keep in touch with that person, and I'm sure they will be very helpful because they are nurses, and nurses are known for their helpful nature. So get their help, get to learn more about this community health officer post. Okay. So the next thing is you must have a lot of knowledge. Now, lucky enough, just after your B.Sc nursing or post-basic B.Sc nursing, you're going to apply for this job, and you will not definitely forget your preventive care, promotive care, therapeutic, whatever you've learned in nursing, you're not going to forget. And I'm very sure wherever you're posted, you'll be able to provide primary care, secondary care, and the tertiary care in your own health and wellness center where you are appointed. Okay. Next is, if you want to become a community health officer, what I want you to do is learn the languages. Okay. If you now you have studied, you're a Keralite who has studied in Tamil Nadu, you get a posting here. I want you to learn the Tamil local language. And believe me, there are a lot of slangs in the language. Okay. In Coimbatore, where I am placed, it's a Kungu Tamil, where we give a lot of respect. And in Chennai, it is a different type of Tamil. The same thing applies for girls in Kerala, for those from Thiruvananthapuram and what is Cochin and so forth, so on. Okay, so the slang is very different. I want all of you to learn the language. Now, this is the time. Utilize this time. That is what I'm trying to tell you. Okay, utilize this time to learn some languages. Then you must be, when you learn these languages only, you'll be able to do your regular home visit where you'll meet the family members and you'll be able to talk to them about health promotion and preventive and whatever activities you want to carry on with them. And next is the interaction with the people. You will have to interact with a lot of people in the community. So language and your communication skill is very, very important. Soni, is there something you want to tell me?
Yes.
Is it time?
Time. 5. How many minutes more do you need, ma'am?
10 minutes.
Okay.
Yeah. Okay. Then you have to interact with the community because you have to have the community cohesiveness to bring about a change in the community. And you are the sole person responsible for the community health. Take that as your responsibility, be accountable, and you will have to communicate with the people in the community, the leaders, the different organizations, and so on. And you must have the ability to educate. Okay. Every opportunity you find, you must try to health educate the people, whether it is incidental or planned, for individual, family, and the community. Okay. Networking is very important. So learn to do networking right now. Try to contact people who are on this field and keep in touch with them. And this will help you because you will have to communicate with the government, the non-governmental agencies, with your co-workers, and so on. Now, diagnosis. Okay, this is part of your job profile, and you have to know how to do the diagnosis with the point of care equipments which are available. And for heaven's sake, all of you should know the normal values so that you're able to diagnose the disease at the primary care level and give care accordingly. And this is a time I told you this COVID is really a blessing, and I want all of you to undergo this yoga course, which may be a 10 days course somewhere, and somewhere 1 month or 2 months. And if you have time, enough time for 6 months, because you must get a certificate. If you get a certificate, you will be able to coordinate with your care. And this complementary medicine also. There are short-term courses, online courses, which you can undergo. This will all help you when you become a community health officer. And you must build the ability to identify. Now this population empanelment, what we tell the community is, you're going to identify that one single individual who's going to come to you for care. You're going to, identify the whole population which is affected, okay? Well, the iceberg phenomenon, which only you find a few on the top, no. You're going to find out who are below and give care to them, okay? And your team building capacity should be awesome. Because you're going to work with all the health workers, the ASHAs and other multi-purpose workers. So the team building is very, very important. Okay. Telecommunication. I don't know how many of you have really participated in telecommunication. There's something like this webinar which is going on. If you want to ask me a question, you can come live on the screen and I can answer your questions. So for those of you who are feeling very shy and come onto the screen now and you can address. This is how you learn to communicate, and this will help you in your telecommunication, and this will help you in your referral services, clarification with authorities for care, and all your virtual learning when you become a CHO. Okay. Now capacity building. This is very, very important in the community. As a CHO, this is local solution to local problems. That means the community themselves, they can solve their own problems. You must help them solve their own problems with their own resources available, and they must be able to shape and control their physical environment, their social environment, the economic environment, and the cultural environment. And that is what is capacity building. For this, you will have a training in your tenure if you become a CHO. Okay, community mobilization. What I mean to say is, you will make no difference at all between anyone, and you will have to equally distribute your resources and your finances and whatever incentives equally to all the people, big or small, caste or creed, everything. Okay. Then you'll have to be techie savvy, and I don't have to tell for this generation at present, but make sure you make use of it healthily. Okay. Because this is going to help you in continuum of care, and everything is going to be on electronic media, the health record of the population. So you'll be carrying a laptop, a tab, and a mobile, and you'll be really techie, I swear. And you're not going to carry a big bag, a community bag when you go to the community, but you'll have a small laptop, and you'll be really trendy as a CHO. Okay. So you'll be able to track everything with your computers. Your computers. Okay. Now, ambassador. What I mean by ambassador is, you as a CHO, you have to be an ambassador yourself, and you'll have to make sure you create an ambassador in the community level. What I mean to say is, all the health promotional activities in the community, the Ayushman Bharat, they have said they're going to identify school teachers to take up the job of an ambassador for health promotion activities, for which you have to educate them. So you have to walk the talk and make sure you educate the school children, the community, and everybody, the youth, the women organization, whosoever you come across for health promotional activities. Okay. Money matters. Yes, you are responsible for the financing, and you will have to make sure the distribution, you just because the certain person is your 5 minutes, Sony, 5 minutes. Okay. Just because you know them, you cannot be giving them a different sum of money. It is going to be equal for everyone, universality, and so on. Okay. So resource allocation, everything matters. And care pathways. Now, all of you should learn all the algorithms which you're practicing in your hospital. Maybe you will follow the same algorithms when you become a CHO, but make sure you only follow that, because that is only going to be uniform throughout in all the primary health, updated primary health centers and sub-centers. Okay. treatment guidelines, everything is going to be, it should be in the tip of your fingers. Okay. And you must have the analytical skill. Okay. Now, when we ask you something, don't give us a big description of what is happening in the community. What we expect from you is the values, the population database, in numerical form or in graphical form. That what I mean is pictorial form. Okay. You're accountable. What I mean to say is you are having a lot of multitasking to be done. You'll be juggling between your job, but make sure you're accountable to the individual, family, and community, and the co-workers, to the government and to the non-government agencies for whomsoever you're working with. And counseling skill is a must for all of you because you have a lot of opportunities to do the health promotion at your level. Okay, so you have to, I'm sorry about this. Okay, I'm sorry about this again. I think the same slide has been repeating. Treatment protocols, yes, you must follow the treatment protocols, which is stipulated by the government for your subcenter, which is going to be uniform throughout. So make sure you use the drugs effectively, okay, and research, okay. Now, all of you nurses, B.Sc nurses or post-basic nurses, this research component is very important because you're closely working with the community. An epidemiological survey, so much is there in your hands. So have this as a component. It's only 2 minutes. Okay. So documentation is very important for all of you. Yes, you have to maintain your registers and so on. The future, I just want to tell all of you, you take an exam, the MLHP exam, you will be on a contractual basis. Then for after 6-7 years, you get a regular CHO post. Then you have to write an exam. Then you'll become a CHO or the PHC, where you'll be taking care of the clinical care and monitoring of public health. And then you'll have a 1-year training of public health management, CHO after 5-6 years at the block level. And then you have once again an exam. And finally, you'll be a district community health officer, where you'll be able to implement national health programs, or you'll be a faculty admin in a college or school which is educating the nurses all in the district hospitals, where you'll be assisting the other health workers or working along with them. Okay, so you're 22 years now, and by the 34 years, you become a CHO, the PHC level. At 40 years, a community health nurse, and at the early 40s, you are a district community health nurse. And I conclude again, you as a CHO, the health of the nation is in your hands, and by providing the health, you'll make our nation the most wealthy. And Soni, I'm sorry, I know I have taken a lot of time. Thank you so much. And I'll wait for the question and answer session. And thank you very much.
Thank you, ma'am, for the elaborate. I think after hearing ma'am's talk, bedside nurses going to hospital will be very few. I think most of them want to be joining as community health officers. So thank you so much, ma'am, for the, and especially your AV8, superb. Usually they say, community nurses are very good in preparing the AV8s, and also you have again proved it, your skills of communication. Thank you so much, ma'am. Sorry for interrupting you, ma'am.
No issue at all, because you already gave me liberty to take another 5 minutes. Thank you.
Thank you.
Thank you.
Okay, now next speaker before we, let me invite Dr. Soni M. Verghese, HOD of Community Health Nursing, MOSC College of Nursing, Kolancheri, to talk on the topic Challenges of MLHP. She pursued her PhD from Annamalai University, both her UG and PG from Sri Ramachandra University, Chennai. She has organized and participated in various workshops, and she has also published and presented papers in national and international level. She started her career as a lecturer and then climbed the ladder. And she's an approved PhD research guide under the Kerala University of Health Science, Thrissur. She is also the university co-committee member in MLHP program in Kerala University of Health Science. And her passion is watching news. As Janie ma'am had told that you have to watch news, read newspapers. So I think ma'am is well apt for this occasion as she's a committee member of the Kerala University of Health Science. Ma'am, the virtual platform is all yours. Soni ma'am? Are you there, ma'am? Soni ma'am?
Yes, madam. Thank you, ma'am.
Okay.
Good morning, all. And I take this opportunity to thank the management, principal, vice principal, Soni ma'am from Pushpagiri College of Nursing, and our principal, Professor Dr. Sheila Chennai, for giving me this opportunity to one among the epitomes like Kanjana ma'am and Janie ma'am. So thank you, ma'am. So let me move on to the session. So I am going to take session regarding challenges of MLHP program. Before moving on to the challenges of MLHP program, let me discuss regarding the conceptual framework and the operational strategy. So here, Kanjana madam and Janie ma'am, they both gave us a detailed explanations or clear informations regarding the MLHP program, what the community health officers are supposed to do. Okay, so we just have a look into that again. So the MLHPs are health workers. They are trained at higher education institution, and they are authorized to work autonomously to manage and render preventive and promotive care. So we will be there. We are focusing on to the partnership and coordination, operational planning, implementation, and monitoring. So regarding the partnership and coordination, like Kanjana ma'am and Jenny ma'am said, the mid-level health providers, they are the bridge or the liaison between the multi-purpose health workers, ASHA workers, and the other medical practitioners in the health center. See, like we all know that these ASHA workers or the multi-purpose health workers are the people who are working in the village level. So they are in direct contact with the people in the community. Okay, so what happens here when you, as part of this Ayushman Bharat, when we introduce this MLHP or the community health offices, what happens here is, so we will be supporting or coordinating the work which is done by these ASHA workers or the ASHA workers or the multi-purpose health workers. Our focus is to render the primary healthcare services at free of cost, and we should get a maximum utilization or the maximum benefit from the people in the community. So here the community health officers are trained at the higher education centers. So their level of education and their skill is far, far better compared to the other workers in the community. So when you incorporate this cadre into the health and wellness centers, our involvement in the community can increase the utilization of the free services which is given by the government. So that was the partnership and the coordination. The next is about the operational planning. So the study's result shows that 11.5% of the people from rural and only 4% of the people from the urban utilizing the healthcare services, our primary healthcare services. So that indicates the low utilization of the public health system. So how can you manage this? We need to improve the utilization. We don't have to pay even a single price. But like Kanjana ma'am said, even for the common cold and fever, the people may go to the tertiary level hospitals, which is easily accessible or at the community level. So what we are supposed to do, we have to educate. We have to be with the people. We have to be with the ASHA workers or the multi-purpose workers. Okay, so we will be getting more involvement of the people in the community. Once you are getting a participation or involvement of the people in the community, our planning or our operational work will be much better. Okay, so thereby the people are aware of what are all the services available in the community. The ASHA workers are aware of the healthcare services, but they are not giving much ideas or information to the people in the community to utilize effectively by the services given by the governments. Okay, so this is how you can do the community mobilization, knowledge translation, and you can improve the quality of care. And the third one is implementation and monitoring. So like ma'am said, we will be forming a primary health. So this team helps to implement expanded package of services. So how can we do this monitoring or the evaluation? So we can go for the population-based analysis. So in that, through the population of the people registered, screened, or treated, like we will be doing a comparison after implementing this MLHP cadre or the community health officers cadre, whether the people satisfaction have improved, our health standards have met the defined goals, quality of life and the standard of living, whether these things have changed or not. That can be assessed through the people satisfaction in the community. So here you will be concentrating on these aspects, the MLHP workers. So how can you achieve this? Here we have to conduct state level orientation workshops. So like ma'am said, each state the things are different. Here in Kerala, we have not started this. Okay, so once we start the state level, we have to conduct the orientation program for the novice regarding what they are supposed to do in the community, what are all the services they are supposed to do, what are type of medical emergencies that are supposed to, like what are the roles and responsibilities the MLHPs are supposed to do in their area where they are assigned. Okay, and we need to have a program study center or TOT training centers. And we all know that for the B.Sc nursing program, we have a standard structured curriculum or the syllabus. So our students, when they are new to the profession, we will be giving an orientation regarding the syllabus or the clinical skills, what they are supposed to achieve by the end of their course. Okay, so in the same way, we have just started, we are in the beginners. So we have formulated, like INC as well as the KNC have given us the certain topics which we are supposed to train our students. Okay, but we need to standardize again our curriculum or syllabus related to the MLHP program. So, and we will be monitoring again the assistant. So this is actually about MLHP. So now we will move on to the challenges. Okay, so I have arranged these challenges into the three categories, like the health provider challenges. What are all the mid-level health providers challenges they are supposed to undergo when they are in the field, or the regulatory and management challenges, and what are the challenges while incorporating it into the curriculum. So we'll see one by one. Health provider challenges. First one is vast gap in our knowledge regarding functioning. Yes, of course, the councils have given or the universities have given the syllabus and 43 points and 34 things which we are supposed to teach our students. Even then, we are not crystal clear about what we are supposed to function in the community. Like what are all the medical emergencies we are supposed to meet, how we are supposed to meet. Yes, of course, we are trained in all the years, first year, second year, third year, and fourth year. But these challenges, why these challenges are coming, it is only because now we are in the beginning stage. That's what I am talking about, the challenges. Okay? Then, so there is a knowledge gap regarding the functioning or the roles and responsibilities of the community health offices. And the next one is acceptance among the people. Okay, so we know that community health officers are workers with training less than that of a physician, but we are trained and knowledgeable more than that of the other workers. Okay, so for example, if any medical emergencies which happens in the community, we are trained or we are educated, we are competent enough to handle those emergencies or the issues. But we don't know whether the people in community are ready to accept that. Okay, so that is another challenge because we are just a beginners. So we have to create. So how can we manage that? Being a beginner, working with the people in the community. See, we all know that the community health nurses, once we go to the family, so by creating a very good rapport or bringing change in their behavior, we could get a very good acceptance among the people. Okay, so what we have to do, we have to implement the activities or the functions which is rendered by the health centers, governments. So once you implement the activities given by the health centers, people are ready to accept that. Once they accept the health services, of course, there will be a change in their health standards. Once the health standards are changed, the people in the community will be ready to accept. This is how we have to manage that acceptance. Okay, and the third one is lack of attention to crucial management issues. So the capacities needed to respond to the current emerging issues are not well understood. If not well trained, or if we are not well supported from the health workers, we may face crucial management issues. Okay, career progression. So the madam, towards the last slide, madam is explained that we may get chance like in the district hospitals and specialty hospitals. So we need to be sure about, is there a career progression in the beginning stage? What I understood is, in the beginning stage we are going to post as community health officers in the health and wellness centers. There's nothing but the sub-centers are going to come to the health and wellness centers. We need a career progression from sub-center to PHC, CHC, district hospitals, so on, like that. So that need to be assured. Okay. Then continuing education program. So we know that it's a lifelong learning process, nursing. So we cannot learn everything from College of Nursing or from the college. So the field of healthcare is continuously evolving and improving through an advancement in technology and knowledge. So we need to have a continuous education program for the community health officers regarding the trends and issues, or the current updation of the activities or the services, what we are going to implement or incorporate in the health services. And the next one is the attrition of MLHP. Okay, so because of all these challenges, there is a chance for the attrition of community health officers. These are all the challenges that health providers may face when they are in the community as community health officers. But these challenges are manageable. The challenges are not for lifelong. It is only because we are in the beginning stage, we may face these challenges, but we have the solution among us. We have to take that solutions and we can identify challenges. So next is about the regulatory or management challenge. Okay, so first one is the regulatory and integration issues. So regulation refers to the process used to designate an individual have met established standards set by an agent. So the regulatory body should define the laws and regulations in nursing. The community health officer, and that helps to provide protection to the community health officers and society people in the community. So we need to get support by the professional members, and we need to set the standard of nursing practice, and the scope of practice and accountability need to be addressed. Okay, so next is about the legitimacy, management, governance, and evidence must be addressed. So these community health officers have their scope of practice defined by appropriate legislation. So the quality approach must include mechanism to ensure the desired competencies. So need to be properly managed, motivated, supervised, and supported. So the regulatory and professional bodies should speak on behalf of community health officers regarding the issues of remuneration and scope of practice. And we need to critically examine the existing evidence on the evaluation and their impact on health outcomes. Like ma'am said, we will be assessed based upon our performance. Okay, well, how we are going to render the care, how we are going to improve the quality of people in the community. Of course, we need to be evaluated based upon the performance. Okay, so but we need to be clear about how we are going to be evaluation or to get evaluated, or what are all the evaluation criteria which they have formulated, or is there any set of standardized evaluation criteria to evaluate the people. So these things need to be clear. That is again a challenge. Okay, all these challenges has to be met by the regulatory bodies. Okay, regarding lack of standardization, staffing, and learning sites. And other management challenges are like policy recommendations. So the policy recommendations. So the increase in number of community health officers should be among the policy options considered by countries facing shortage and maldistribution of the healthcare workers. So the improved education, management and regulation practices, integration in health system have the potential to maximize the benefit from the use of cadres. Okay, recruitment. The recruitment has given a detailed information regarding how we are going to be recruited. After recruitment, how we are going to give special training under the health centers once we are appointed as the mid-level health providers. And proliferation of the cadres. They are considered key cadres to render healthcare in the short to medium term, but more likely in the long term as well. So they are neither properly integrated nor adequately planned or managed. So that is regarding the regulatory or management challenges. Okay. So next is about challenges while incorporating it into the curriculum. So standards should be comprehensive while addressing the curriculum, and the infrastructure, equipment, facilities, and faculty and other component quality standards at training university. And they're not a substitute for supervised clinical training. So here in our university, what we have decided, only just now we have started for the final year students, we have incorporated it into the community health nursing. So we have we have taken the classes of the MLHP. Okay, so what our plan is like, we will be forming a logbook. So from first year onwards, students will be trained specifically on the MLHP program, and they will be they will be having a separate logbook. Okay, so not only the community health nurses, so community like all should be included in the community. So the department of nursing, pediatrics, OB, and psychiatry. So all specialty teachers will be focusing in each year from first year, second year, third year, and fourth year. So by finishing the final year, we'll be getting a logbook like they have undergone the MLHP training program, which is prescribed by the INC as well as the university. But only for this year, we have included this in the fourth year since they have completed their first year, second year, and third year.
Tony ma'am, how many minutes?
Ma'am, for a few minutes.
Okay.
Going to finish, just 5 minutes. So towards better management of MLHP program. So these are all the recommended strategies. Standardize the cadres, develop benchmarks for creating new cadres. That can be done by Ministry of Health, Human Resource Directorate. And define the roles and skills, the professional body. And now review, develop, standardize the curriculum, regulate staffing and learning sites, ensure provision of continuing education. This has to be done by Ministry of Health, Education, higher education institutions, professional bodies, and the local government. And need to identify the regulatory structure, integrate MLHPs into regulatory bodies, review the scope of practice, develop career structures and progression, and standardize the remuneration and incentive structures. That again has to be done by the Ministry of Finance, professional bodies, public services, and Human Resource Directorate. And collect routine information on numbers, distribution, training, deployment, retention, and progression. So this is to conclude. Overcoming the health workforce crisis is a challenge, but to achieve universal health coverage, community health officers can be a part of the solution. So we are living in the middle of difficulty, but the opportunity lies in the middle of these difficulties. So we have many challenges. Being a community health nurse, we have to prove that we can bring change in the people in the community. So that is the challenge. So you move towards that challenge, improve the standard and quality of life of the people in the community, thereby being a catalyst, thereby we can improve the standard of community health nurses in the country. So thank you all.
Thank you, ma'am, for enlightening us with the challenges of the MLHP program. Thank you, ma'am. So now it's the question and answer session. So a lot of questions have come. So Dr. Kanchana, there's a person who has asked, the name is not written here. The benefits provided to the community are immense, but is the community aware of these programs? And how can we make sure they are well aware and they have got these services?
Actually, we can, the ultimatum is what services are provided, they are not aware probably. But there is a card, there is an insurance card, all that they are well aware. As I said, we are the advocates. Community health nurses are the advocates, the nursing students who are going to the field for exposure and experience, for clinical experience, for the community experience and the field experience when they are going. I think as faculty, we have to empower them with this knowledge so that they can educate them, because when family-based nursing care services are given by the community health nurses during their practice scenario, it is easy for them to definitely communicate this information. So we have so many institutions across India. If one person starts educating 10 or 15 families, I think that's more than enough to cover the complete population. So they know that there is a scheme like this, because every state has an insurance scheme, and there is a health insurance scheme at the central level also. But probably what and all services, like they are not aware transport is not costed. They are not aware that even for health checkups and for the medicines, they can use this card. So even that's laboratory investigations, for everything is free. So these kind of informations, I think through our health awareness and health education programs, even kind of health schemes available should be told by us to the community.
Okay, thank you, ma'am. Another question from Jansen Matthew. Is it made mandatory to teach MLHP in nursing colleges? Is it taught throughout the 4 years or only in final year? And is there an approved logbook in Kerala? Already nursing course is fully packed and tight. Is there adequate space to add MLHP in nursing syllabus? Sorry.
So actually, the 43 skill sets which are given in the MLHP program are being taught over the period of second, third, and final year. But the major set of reproductive child health, maternal health, all that are being done during the final year program. So basics of the skill sets is I'm talking about like giving an injection, or, trying to do a wound care, or doing a small incision and drainage. All that we are doing, learning in the second and third year. The final year talks about delivery conduction, contraceptive education, doing an IUD insertion, talking about family planning to the whole people who are coming there, doing a cervical cancer screening, because at the final year, we have to teach them how to do a pap smear. They should know how to do a cervical, cancer assessment, doing visual inspection using acetic acid, like Via and Willy, which they have to know. All these are what they are expected to know, and that is being taught during the final year program. So this 43 skill sets, when we did a small assessment with the skill sets taught in nursing, all the 43 skill sets are being taught in nursing. Only we have to reaffirm around 21 skills which are being taught in the final year. And that's how, as per the Indian Nursing Council, you don't need to have a specific curriculum. All that I had to review a book on MLHP published by an author. When I saw that all these content are being covered, I think Jaini ma'am has also seen it. It has been covered in the our curriculum. Only thing is reaffirmation of the specific skills, because they are going to act as a head, a CHO, and they are responsible to make clinical decisions at that point of time. So for which we have to reaffirm the skills, and that is why this logbook has been put up, which will help them to learn those skill sets again. So, and that logbook, while they do the entry, they know the flow of assessment and what kind of interventions. So I think, yes, Kerala, I don't know if there's a logbook. I think you should be the best person, Soni, to tell if Kerala has a logbook.
Soni ma'am?
Kerala, I don't know if Kerala has a logbook for the MLHP.
Soni ma'am is there? Soni ma'am?
Ma'am, actually, at present, we don't have a logbook, ma'am. So we are planning to prepare the logbook. What we are planning to do is, like, we have logbook for the first year, second year, third year, and we have the logbook now, ma'am. So in each year, we will be incorporating that. We will be adding on to the logbook. So what we have decided now is that once for the present batch, whomever they are going to pass out, the principals will be mentioning in the transcript like they have undergone the MLHP training program. That's what they have decided at present by the university.
Yeah. No, actually what I feel, Soni, if you're planning for a logbook, have a separate logbook for MLHP. That will add value while you take it, because when you're going to apply for a CHO position, then the logbook can work as a skill document that you have completed.
It's a profile.
Yes.
Profile that they
Yes,
prepare
ma'am.
for them.
That is under process, ma'am. Now
Okay.
that is under process, ma'am, to form a separate logbook. We are forming a separate logbook, ma'am.
Yeah, for MLHP that has to be done. And in our logbook, the
logbook will be there.
skill activities, the one sheet has been attached with the major logbook which we are doing for the 4 years. So what 43 skill activities we have listed and attached it with the final year papers. So that's what we have done at Tamil Nadu, and this logbook is now it was published in January, and most of the colleges have purchased it and they are doing it now. Yeah.
Okay, ma'am. Is the previous passed out B.Sc or post-basic or MSc nurses eligible to apply for this post?
They have to undergo the 6 months training program.
Okay, ma'am.
Yes.
Then another question, why some of the states are still hesitant to introduce this MLHP, that is the community health officers post?
There's a political agenda behind it, so I don't know if we can talk it. But still, even ASHA, does Kerala has ASHA? Does Kerala?
ASHA, yes, ma'am, ASHA is there.
In Kerala, but here we do not still have ASHA. When Rajni Ved, whom I met, who's in charge of the NHRC in Delhi, so she said we are still trying to fight through the NHM to get the ASHAs in place and to get the CHOs in place, all that. So I think there's a lot of barriers which we are facing, but our nursing leaders at Tamil Nadu are trying to, through associations, we are trying to break those barriers to get the position of CHO for nurses in Tamil Nadu.
And we have learned the lessons from the North India that CHOs are really doing well, and the health outcome. And when I was preparing for the webinar, when I was going through the literature, a lot of research states that community health officers, the nurses, the health outcomes brought about by the nurses and the physician, there's no difference at all. Okay, so we can really show all these papers and prove that we are capable of holding the community in our hands and we are safe to deliver the care.
Yes, ma'am. So another
there
person.
is a link for in case they want to get this testimony from the CHOs. There is a link which I don't. Jenny ma'am, you shared with them the link. I can share it with Soni ma'am. The link.
I'll
they
put it
can
up in
go
the
through the YouTube link.
Yeah, that I gave them.
You gave them. That was
Yeah. In the presentation, I gave them.
Yeah, we have got.
Yeah, you can forward the link to all the participants today so they can have a hold on the testimony of how a CHO independently works. It's really lovely. And one CHO, you can see how passionate they are about the community health activities. So most of them are just telling what they are doing. So it's not, and nothing is textual. It is all experiential.
Yes, real rich experience.
Yes.
Fatima Jumana has asked, do we need any clinical experience to apply for CHO?
No, as of now, no.
Okay, ma'am. These are the most of the questions are repeatedly asked. So I'm not, almost the similar questions have come. Any other questions from the participants?
There was one student who asked, comprehensive healthcare
yes,
given?
Comprehensive. Yes, ma'am.
Yes, of course. Yes. Why this question? We are capable of providing comprehensive healthcare.
Not only when you're wearing your uniform, should be out of your uniform also. Your neighbor should be benefited from your knowledge. Your family members should be benefited. Your friends. No, you can, even your WhatsApp status can hold all the things. There's so many avenues for you to share the knowledge and information. So,
ma'am, another question. Ma'am, another question. Both sub-centers and PHC will be converted into health wellness center or only sub-centers?
No, sub-centers will be converted into health and wellness centers. PHCs will have additional services being provided through this program. Like I said, screening for non-communicable diseases, the Via Valley program for and SB, all that will be an additional program under PHCs.
Okay, ma'am. As a CHO, whether we can prescribe medicines, a question by Tiju Thomas.
Yes. And
So actually, there is a standardized formulary which is there. Ma'am, you can go ahead. You can tell.
yes, there is a standard protocol which they have to follow, and it is the same throughout India. Okay, the same protocol. That is what we call continuity of care. Whether they're going to be in Kerala or Pathanamthitta or in Coimbatore or in Trichy, when they go to the wellness center, it is going to be the same care, the same kind of drugs. There's not going to be any difference, and the treatment protocol is also going to be the same. So they have to know, they have to have everything in their fingertips if they become a community health nurse.
There is a feasibility that even teleconsultation prescription can be given.
Yes.
The telehealth, if in case they have, for example, there is a specificity that you want to show the sign or the component which you want to show the medical officer at the PHC, WhatsApp consultation can be done, and prescription through teleconsultation is also feasible, which will be done through the CHOs.
Yes.
Jitya Jain has asked, qualification of a nurse to become the head of health and wellness center.
That's what
B.Sc
you're a B.Sc
nursing.
nurse.
GNM or a B.Sc.
Okay, ma'am. So most of the questions we have answered. Thank you, ma'am. Kanchana ma'am, Janie ma'am, and Soni ma'am.
Yeah,
now,
thank you.
Thank you, ma'am. Now, I invite Sister Mayuka to say words of gratitude. The feedback link is put in the chat box. So kindly do submit it. Otherwise, you will not be getting your e-certificate. It's also there in the YouTube also.
Good afternoon to all.
Good afternoon.
Dear participants, on behalf of Pushpagiri College of Nursing, Community Health Nursing Department, it's my pleasure to propose a vote of thanks to our eminent speakers, Dr. Kanchana S., Principal, MLHP College of Nursing, Chennai, Dr. Janie Kem, Principal, GNMKM Institute of Nursing, Coimbatore, and Dr. Soni Verghese, HOD and Professor of Community Health Nursing Department, MOSC College of Nursing, Kolancheri, Kerala, for accepting our invitation and being the speakers for today and for their excellent presentation. I would like to thank our chief guest, Dr. Santosh, Principal, Pushpagiri College of Pharmacy, who honored this function with his inspirational words. I thank the management, principal, vice principal, teaching and non-teaching staff, students, delegates, organizers, and the IT department of Pushpagiri Medicity, especially Mr. Thomas, Mr. Marvin, and Sister Serena, for their constant support and encouragement. Once again, thank you all. Thank you.
Thank you all.
Thank you.
so
Thank you, ma'am. Thank you all.
Thank you,
Bye.
Thomas, for taking us without any glitches in the technicality.
Yeah.
Thank you, ma'am. All by God's grace.
Yes,
Today
yes.
we had a very nice climate. Rain was out from the Pathanamthitta,
Okay.
from where we started this program. It's all God's grace. Thank you,
Yes.
all of you, from the bottom of my
you.
heart. Thank
Okay,
you.
okay. Thank you.
Thank you. Thank you. Bye. Bye.
Thank
bye.
you. Bye.
Thank you,
Kanchana.
participants. Thank you, participants.
Bye, Jenny ma'am.
Yeah, bye. We'll leave.
Bye, bye, Soni.
Bye, bye, bye,
Bye,
ma'am.
bye, bye, bye.
Bye, bye. Thank you. Thank you. This is Soni signing off. Have a great day. Oh, thank you. Hello? 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 Vimal sir? Hello? Hello? Lata. எடி என்னடி என்னடி ஃபீட்பேக் லிங்க் போட்டேனே வரலையா? நான் வந்து உன்னோட இதுல நம்ம இதுல வாட்ஸ்அப்ல போடுறேன். chat box கேட்டு once again sister Sarina chat box ൽ ഒന്നുകൂടെ ഒന്ന് ഇടാന ആ ഫീഡ്ബാക്ക് ലിങ്ക് ഓക്കെ ശരി ഡി താങ്ക് യു ബൈ പകുതി